Good morning, my name is Dr. Jeremy McAnulty from New South Wales Health, and I'm here to give an update on the COVID numbers for New South Wales for Friday the 19th of November 2021. There were 216 new cases of COVID reported in New South Wales in the 24 hours to 8 o'clock last night. At the same time, there were more than 72,000 tests reported in New South Wales. In terms of vaccination, we now have 94.3% of people aged 16 and over who have had one dose of vaccine, and 91.5% who are fully vaccinated. Of the people aged 12 to 15 years, 80.8% have received one dose and 74.6% have received two doses. In terms of hospitalisations, there are currently 196 people with COVID admitted to hospital in New South Wales, 28 of whom are in intensive care and 15 require ventilation. The people in intensive care, 20 are not vaccinated, 3 have received one dose of vaccine, and 5 have received 2 doses of vaccine. In terms of sewage detections, New South Wales Health's ongoing sewage surveillance program that looks for fragments of the virus that causes COVID have detected positive findings in the communities of Denman, West Wyalong and Coonabarabran. So anybody living in these communities or been there recently, please watch out for symptoms and get tested straight away if you get even the mildest of symptoms. Sadly, we're reporting the deaths of 3 men today. A man in his 50s from southwestern Sydney died at St George Hospital. He was not vaccinated and had underlying health conditions. A man in his 60s from Wollongong died at Wollongong Hospital. He was not vaccinated. And a man in his 80s from Albury died at Albury Base Hospital. After acquiring his infection at Corowa Hospital, he'd received one dose of COVID vaccine and has underlying health conditions. We'd like to express our sincere condolences to the family and loved ones of these people who've died. So as we have high vaccination rates in New South Wales, but we need to remain vigilant and maintain those COVID-safe behaviours. So as restrictions continue to ease in New South Wales and the state transitions into living with COVID, it's vital we all continue to practice those good behaviours that keep us all safe. This includes coming forward for testing if you have even the mildest of symptoms, wearing a mask where required, particularly indoors, maintaining physical distancing, maintaining hand hygiene, so washing your hands with soap and running water for 20 seconds or using alcohol-based hand rub, and always checking in with the Service New South Wales app. And parents are particularly asked to watch out for symptoms in their children and keep them home for children and get a test if they have any symptoms at all. That'll help protect the rest of the school. Fully vaccinated international arrivals must comply with the New South Wales Health Guidelines, which includes testing and restrictions on entering certain high-risk premises. And they are required to have a COVID PCR test within 24 hours of arriving into New South Wales, and again on or after day 7. Children and those with medical contraindications who are not fully vaccinated require similar tests and should have a further test on day 12. Until a negative test is received on or after day 7, international arrivals are unable to enter high-risk settings such as aged care, disability care, healthcare and correctional facilities. And not following these guidelines put family, friends and the community at risk and also can attract heavy penalties as their criminal offences. But thanks everyone for coming forward to getting vaccinated and for coming forward for testing if you have even the mildest of symptoms. These measures are important in keeping our community safe.